in today's health segment from Chittick Eye Care with what you need to know when it comes to glaucoma is Dr. David Solá. Welcome.
Thank you.
Okay, so you're kind of brand new here to Chittick Family Eye Care. Tell me a little bit about your background.
Yeah, no, thank you so much for the invitation. I'm so excited to be here today. And right now, I'm coming here from Boston. I'm a glaucoma and cataract specialist in Boston at Mass Eye and Ear, but I'm moving here in February to start with Chittick Eye Care. And I hear I'm going to be the only glaucoma specialist in like 100 miles.
No pressure.
So, I know, no pressure there. No, but I'm very excited to be coming to the Midwest, to be coming here to Central Illinois and just offering a service that I think is going to help the community and help patients.
Absolutely. If now they don't have to drive, you know, a lengthy distance to get their vision checked out. Let's talk specifically glaucoma today. What is it?
That's a great question, and I think it's something that people sometimes don't understand very well. The definition of glaucoma is optic nerve damage. The optic nerve is the cable that connects the back of the eye to the back of the brain where the images get processed. And sometimes when the pressure goes really high in the eye, that optic nerve can die slowly, and that can lead to permanent vision loss. So that in a nutshell is glaucoma. But a lot of patients sometimes feel like just having high eye pressure is glaucoma. Not necessarily. Some people have high eye pressure, but their optic nerve is still healthy. But it's important to notice it early and treat it early so that their optic nerve stays healthy.
So here's kind of the development that you were talking about.
Exactly.
So walk us through top to bottom what we're looking at.
Yeah, absolutely. In a healthy eye, there's an area behind the iris, which is the color part of the eye. We call the ciliary body that produces fluid that we call the aqueous humor. That fluid fills the front part of the eye. And in a normal eye, that fluid gets drained through the trabecular meshwork. That's a fancy term for the internal drainage system of the eye. But in glaucoma, usually that internal drainage system of the eye, the trabecular meshwork, is damaged and it doesn't drain properly. And then it leads to fluid buildup that then ends up damaging that cable in the back of the eye. You can see it in the third image there. And eventually that cable thins and eventually it can die.
And that doesn't sound very fun.
No, it does not. Yes.
So let's talk risk factors for glaucoma.
Absolutely. There's a lot of risk factors for glaucoma. I would say age over 60. I think if you're over 60 years of age, you should get checked for glaucoma. If you have family history, especially first-degree relatives, that's really important. If you have been told by any eye doctor that you have increased eye pressure, as I said, it's good to treat it early so that that optic nerve doesn't get damaged. If you have a thin cornea, the cornea is a clear front part of the eye. Sometimes when it's very thin, those patients are also at increased risk of glaucoma. Race, African-American patients, Hispanic patients are at increased risk. If you use steroids, the list goes on.
Well, yeah, I mean, there it is, we're seeing there. So if people have concerns about you know, glaucoma, their vision, their eyesight, it sounds like maybe prevention is the way to go.
Absolutely.
So what do they need to do when they're starting noticing signs?
So that's actually one of the key things about glaucoma. Glaucoma is usually a silent disease. It doesn't give you a lot of symptoms. So that's why it's actually so important to just get your eyes checked. A lot of patients can lose a lot of vision before they actually notice anything. And glaucoma can be sneaky that way. And that nerve can get so thin, and people are still seeing 20/20 in the center of their vision. They think they're fine, but they're not, and they need to be treated. So I think the best thing is if you have any risk factors, please come see us and get checked.
Okay, you'll be in town starting in February.
February
yes?
1st, 2024.
Okay. Well, if anybody has some concerns, some questions, maybe they want to get their vision checked out, maybe start that prevention now. Welcome to town.
Thank you so much.
And we're glad that you're here. If you want to learn more about Dr. Solá and the services that he's now providing at Chittick Eye Care, we will connect you at ciLiving.tv. And we do appreciate Chittick Eye Care for sponsoring our segment today.